1, 2, 3, 4,
6.
8.3% of the American population has diabetes. Out of that 8.3%, only 5% has type 1 diabetes. 1 in every 400 children has type 1 diabetes. My sister is one of those 400 who has type 1 diabetes. Diabetes is when your pancreas does not produce enough insulin to properly control the blood sugar in your system. Diabetes is insulin dependent and is considered juvenile because there is no cure. Some symptoms of type 1 diabetes are high blood sugar, feeling tired or fatigued, feeling thirsty, losing weight without trying, blurry eyesight, deep rapid breath, dry skin or mouth, flushed face, unable to keep down fluids, nausea, vomiting, or stomach pain. My sister had signs of being very thirsty, unable to keep fluids down, nausea, vomiting, or stomach pain. She became very sick and started to show symptoms, which at the time we did not know were symptoms of diabetes. When her blood sugar became very high, she became non-responsive and had to be rushed to the hospital by ambulance. My mother was told she was in a diabetic coma, which to us made no sense because she had not been diagnosed with diabetes. My sister had a 3% chance of surviving. She spent 3 days in the ICU in a diabetic coma. My sister, like most people, was not diagnosed with diabetes until her early teens. 1.9 million people 20 years or older were diagnosed with diabetes in 2010. Diabetes is a lifelong implication with no cure. And since type 1 is an insulin dependent, people such as my sister have to have daily doses of insulin. There are 2 ways for them to take the insulin. The most common way is through a shot in the stomach, back of the arm, or the leg. Another way is by using an insulin pump, which is hooked up to their side at all times. Insulin pump looks like a pager and has a tube with a needle at the end that is inserted into the stomach. The insulin pump looks like this. When my sister was first diagnosed with diabetes, we were afraid she would not survive, since the doctor said she only had a 3% chance of pulling through. Her blood sugar level was off the charts of more than 500. The average blood sugar should be within 70 and 120. We spent a week at the hospital with her learning how to take care of her and how she will have to live for the rest of her life. If you or someone you know has a family history of diabetes, they should get checked out. That was one of the worst experiences of my life, and I am so thankful my sister survived. For a list of symptoms for type 1 diabetes, visit www.diabetes.org, or you can visit ncwbi.nlh.gov and www.umm.edu/patent/articles/what type 1 diabetes for more information on type 1 diabetes. Are there any questions? The different types of diabetes are type 1 and type 2. Type 2 can be controlled with pills or through their diet. Type 1, the only way to control it is with insulin because it's the only way you can survive. There's hyperglycemic, which means their blood sugar is too high, and there's hypoglycemic, which means their blood sugar is too low. Any other questions?
How often do you change the insulin site?
The insulin site should be changed every 2 days. Otherwise, it could risk of infection. Next question.
At what age are most people diagnosed?
Diabetes can be diagnosed at any age. Most people find out that they're diabetic when they're an adolescent, but you can find out when you're born, or you can be diagnosed as early as the age of 70.
The difference between 1 and 2?
The difference between type 1 and type 2. Type 1 means your pancreas does not create any insulin. Type 2 is when it is kind of through food, and it can be controlled through diet, and it can eventually go away depending on how you diet.